All right, so we're going into week 3. I'm starting to get a couple of your pediatric assessment project, those diagnoses, but start bringing them in. I'm actually getting some different ones. I do like to learn also. So yes, I know a lot about a lot of things, but I don't know everything. And I love learning every day. So think of something that, might be an obscure diagnosis that maybe you were diagnosed with as a child, or your children, or your sister's children, or your next door neighbor, best friend had something or has something, and you want to know more about it. And if you do it that way, it's less of a chore to get this project done. So try to think of what diagnosis. That's your project to start thinking as we start going along now. Um, this week is the week of reviews. I do my review tomorrow at 4 o'clock. Um, the reviews are on your calendar, and I've posted them in your announcements. You have the first 3 Kahoots there. You have the study guide Kahoot, the PowerPoint. You have a theorist Kahoots to help you with that. Also, you have all of the list of the reviews. So try to get as many as you can, if you can. If not, know that you're going to see in the announcements exam 1 recordings. And I'm going to put all of the professors' names there. And I'm going to redo the Kahoots, and I'm going to redo the study guide again. And as we get a recording, I'll edit that one announcement so it's in one place. You guys have 3 courses. You don't need 6 different announcements with 6 different, let me get somewhere. So announcement, it'll be exam 1 review recording /info to say. And it's going to be renewed every time we get another recording, okay? Also know that you can go back to my YouTube channel. You have last quarters sitting right there ready for you. There's not much differences to let you know, and I would let you know. Maybe it's the way I explain things, but it's still the same information. And there's not so many changes with questions, et cetera, et cetera. Any questions about exam coming up? Yes, Joy.
When I tried to go into your YouTube thing, it says I didn't have access. Like I tried to do
So,
like subscribe to it.
really? I
Yeah.
have it as a public channel.
Oh,
Um, just go to YouTube, and then in the question mark, put Professor Bogart,
and then
and it
maybe
will
okay.
come up, and you might be able to do it that way
Okay.
instead of going through my link. That's the only
Okay.
thing I could tell you.
All right. Thank you.
Technology wise, that's the only way I could think of what to do for you.
Thank you.
In my limited experiences here, I'm teasing. I'm actually getting pretty good. All right, let's go ahead. Let's start with the PowerPoint. Today we're going to be doing school age. We're going to be doing adolescents. Um, you do have a CJ Sims due this week. Know that CJ Sims must be submitted to me in the correct format. If it's not in the correct format, I will send it back to you for you to fill it out correctly. In the upper right corner, I need your name. I need the left corner has the sim, and then below has the date it was done, and it has the grade. If any of you happen to be a repeat, make sure that I do get this date from now, not from last quarter or whatever quarter. Okay. Also, you do have NCLEX questions. Be careful. Make sure when you do NCLEX questions, you follow the modules and the areas they want you to do. That first set of NCLEX questions is all growth and development. It is not under pediatrics. It's under growth and development. Check infant, toddler, preschool, school age, adolescent, and it will come up with 50 questions on growth and development. This I would do right before your exam because you have a lot of different questions, growth and development that you might see somewhere on this exam, because that's this exam with all your theorists. So how do children act? And all of those milestones that we might see. I don't go into, after 1 year, I don't go into weights and heights and how they're growing and all that. It's that first year that we look at 1 inch per month per 6 months, 6 months, double the weight. triple it at 1 year. Okay. Anyway, so we're going into school age children. School age children. This is my little Christian now. He just turned 8 last week. And he is now a real school age child. Now, this they say, and you're going to see different in the literature, 5 to 12, 6 to 12. But we're as this course, it is 6 to 12 because what's written in the book. It's and starts with the baby teeth by age 6 should all be in. And now those baby teeth should be coming out and the permanent teeth come in. Now, it doesn't mean that all of a sudden they turn 6 and their teeth fall out. Again, it's every child is different. For instance, they say at age 6, teeth will come out. And you'll look at kids in Christian's age, and some of them have 2 teeth out. Christian has 1, and he had that 6 months ago at 7.5. So does it mean 6 months at age 6? No, it just means about that area. We know that children at this age now are slowing down. They're not eating as much. They're not growing as much. They're not gaining as much weight. But from ages 6 to 12, that is cumulative, is a lot of weight and a lot of height that they've gained. Okay. Just remember that. Another thing with school age children, and I'm using my second grandson as my example. This child is 9 years old. He's 5'2" and 145 or 150 pounds. He's a brute. He is a tackle on a football team. I mean, that's this guy. He's 9 years old. And mentally, he is 9 or 8. I mean, he's very mentally, he's not grown up. But because of his look, people try to talk to him more as a mature child, and he's not. He is a 9-year-old child that needs explanations as a 9-year-old. So that's the one thing with school age children. Make sure you look at the age because sometimes they look older than what they are and they need good explanations. So as I said, everything slows down, but by the end of, their school age, their weight is 2 to 3 kilos per year. Weight doubles, and girls and boys are still the same. It's like all of a sudden in middle school, high school, then the boys get taller, right? We know that this is, of course, that age of all I want for Christmas is my 2 front teeth. That's just part of it. With usually it's their front teeth that comes out first. We know they're getting more graceful. We know they're getting less fat. They're getting more muscles. They're getting, more agile, running and jumping and playing. We know that head circumference, all of that, is, we don't look at the chest and the head and all of those things anymore. And we know that this child's face is going to go from that baby face to start going to grown up, that little grown up face. And we're going to start to see who they're going to be as they grow. Their bladder capacity increases. That means that you can go on trips in a car, right? So they don't have to go like every hour or two, unless you're my daughter. And she's still, no matter what. Um, Her bladder capacity increased, but she always had a small bladder. Hopefully, your child, it's bigger and you'll be able to go more. That's what that means. When they're children, they tend to dribble and they don't hold urine as much. That's why you wear a diaper. The heart is really big in the chest if you look at an infant's x-ray. As they become school age, that heart is smaller and the chest looks bigger now. Their immune system is getting so much better. All those immunizations. Also, just think about how many times they got sick, how many viruses, how many ear infections, strep throats, all those things. Now the bodies build up all of those immunities to it, right? Their bones become the ossify, they're stronger. And as I said, physical maturity does not correlate with emotional or social maturity. So again, don't look at the kid and figure out how to speak to them. Make sure you look at their age also. Now, one of the thing about school age children, when we looked at infants, when they're stressed, they cry and they soothe themselves with pacifier. As we get up to toddlers, again, stress, what do you see? You're going to see them regress. They're going to be incontinent. They're going to want a pacifier again or suck their finger again. It's showing you stress. What does school age children do? Well, they don't get incontinent again. They don't suck their finger again, usually. It's usually more things like acting out. Starting to complain of, oh, my tummy hurts, I can't go to school, or going to the school nurse a lot, or picking on other kids and acting out and just not being themselves. When you see a child all of a sudden change, that's usually stress, and that's usually school age. Now, growing up and maturing in puberty, girls mature 2 years before boys. That's what you need to know. Girls tend to grow up and mature and start those periods of puberty before boys. I'm going to go into it more in a second. So assessing a child, well, we in preschoolers and toddlers, we know that sitting on mom's lap and talking to them and doing what we can when they allow us, like an infant asleep, listening to heart sounds, breath sounds. When we get to school age children, it's more of explaining what you're going to do and being honest. Okay, that's all you have to do with a school age child, and then explain it in a manner they understand. Now, a 6-year-old and a 12-year-old have a different explanation. A 6-year-old getting an X-ray, you wouldn't say, I'm sending you for an X-ray. You're going to say, I'm going to send you to this room. There's this big noisy camera, but it's not going to come down. It's not going to hurt you. And you just goes click. And then all of a sudden I can see your insides and I'll show it to you. I always showed my children their broken bones or pneumonias or even their bowels full of stool. I wanted them to see physically with their eyes, because once they see it, they understand it better. So again, a 12-year-old, you'd go for X-ray, we're going to check out your lungs. That's okay. 6-year-old, they think gamma radiation rays are coming out of their eyes, the camera's eyes, and going to zap through them and make a hole in them. I mean, kids think these crazy things because of all these superheroes, Spider-Mans and the webs and other ones that their eyes come out. Anyway, explain it very simply. When we're assessing, you inspect, auscultate, percuss, and palpate. Sometimes just looking at a child visually, you can see what's going on with them. Their color, how are they breathing? How are they holding themselves? Are they in pain? You can see all these things. Lymph nodes should be non-existent unless a child's sick. As in, you cannot palpate them at all. They're not there. If they're sick, then you might see them swollen up. In health assessments, you are learned assessments and testing the hypoglossal nerve on a child. Even infants will stick their tongue out at you. They like to mimic what you're doing, right? So they do, and I've had them do it. Also, be careful with children and breath sounds. They have a lot of upper airway. They can't blow their noses as well. Younger children, remember, breath sounds, if we listen to the upper area, that bronchial breath sounds, right at the suprasternal notch, which is right here between the clavicle, this area is showing as upper airway mucus. And that is telling us, when we listen to the lungs, is it the mucus up here or are the lungs full of secretions? And in a child, that's the hardest thing. What is it? Is it referred sounds or is it really breath sounds pretty bad? All right, like I said, first exam, there's a lot of theorists. That's why I gave you a theorist cahoots to try to help you with it, okay? Now, Freud. What did I say about Freud? Freud is anything about sex. Anything about sex. But in school age, he calls it latency. Now, we have oral, we have anal, we have genital, and then there's this latency here. Now, what is latency? Well, Freud is all about the psych and sexual thing. All right. So, what Freud says here is that as school age children, their psycho or their minds and thinking is to gravitate towards same sex peers, friends. They're starting to get friends now, and they're usually same sex. And of course, then they start talking between them and that, their own development and sharing thoughts and stuff. That's Freud. Now, Erickson. Erickson happens to be about how psychosocial, people around them, the environment around them. You know, school age children like to get praised. They like their peers to think that they're good at something. They like that. So their industry, a sense of industry. When we talk industry, what is that? An industry is a factory, it's a business, right? It's something that's produced and they produce well. A child, what do they produce well? Well, I'm good at spelling. I'm good at math. I cannot run. I fall over. I'm very clumsy. So I told you that industry, what I did well was math, and that was my writing. It was those things. But there's things I can't do well. And that's my sense where I feel inferior about because we can't do everything well. So, Erickson, this is a question you always see on HESIs and NCLEX always. This is one of those big ones that I'm telling you to remember. Erickson's school age is what they do well, their industry, their product. I do it well, and it gives me a sense of feeling good. The other half of that is the inferiority because they can't do everything well. Okay. And they feel like, gee, I wanted to do that well and I can't. I do this good. And, school age children are pretty hard on themselves. Now, Piaget is, remember, Piaget, you hit their butts, they take a deep breath. It's the first thing cognitively they learn. I took a breath. Then we put something in their mouth, usually a little bit of sugar water at birth, right? So now they have to suck, swallow, and breathe. So now they've learned all those things. Then they take a rattle and it's a reflex grasp. And then all of a sudden, oh, I like that. Now it's a voluntary grasp. Wiggle it in the air, throwing sippy cups on the floor, riding around brooms and put their arms out in airplanes. And they've learned how to do all of those things. So as a school age child, what are they learning now? Well, they're learning concrete operations. Oh my God, another word. And I think school age children, these weird words, I've got to put them in a manner that you get it. Now, if something is concrete, it's solid. You can touch it and you can feel it, right? So if it's concrete, I've already touched it, I've felt it, I've seen it. So guess what? I'm able to reproduce that. I can mimic that again. And that's what concrete's talking about also. They're masters of what we call conservation. What we talk about with conservation is, and it's a weird word to use. Now, they're coming up, there's a couple more pictures of it. But if you had two glasses, a short glass, fat, a tall glass, and thin, and you took the same amount of milk and put it in each one, that tall glass is going to look like it's more than that short glass, according to a younger child. That school age child will know it's the same amount, don't matter. I'll take either glass. Or you take pennies and you line them up, 10 of them. We know there's 10. You mix them up, and they're all over the place. There's still 10. This is sort of things that they're talking about. They can understand these little things and changes still mean the same thing. Okay. That's conservation. This is all part of it. The glass, the tall, the skinny piece of clay, smush it down. It's still the same. And then, of course, moving things around, et cetera, et cetera. Now, let me see. When we get up to the end of school age children, we start formal operation, which is actually more of adolescence. Now, school age children have to see something to understand it, to be able to replicate that, to reproduce that. School age children, when they want something, they're going to figure it out any way they can in order to get what they want when they want it. So you told them you're not going out next Friday because you got a D on your exam. And I told you weren't going to go out. So that child's like, but oh my God, it's my girlfriend's birthday and it's the movies and okay. So what does that child do? Well, if I make my bed, I take out the garbage, I hug and I kiss mom, I make her dinner, put her coffee on the morning. And mom says, you've been really good this week. Okay, you can go out. That's what I mean by formal operations. Formally figuring out a plan to get what you want to do it. And you've never seen it before. Nobody's told you it before, but you know what you got to do to get it done. That's formal, that's adolescence, okay? Logical, methodical. I know what I need to do to go out Friday night with my girlfriend. So moral development, morality. So morality is Kohlberg. Now, infants, toddlers they don't know morality yet. They're starting to understand, know the end of, the toddlers. But we started, talking about that in preschoolers. Now, preschooler ages 3 to 5. What do they understand? And they say even up to 7. It's reward and punishment, right and wrong, and a consequence for each. That is determined what the preschooler and the young school age think. It means I'm getting reward for good behavior and I'm going to be punished when I do something wrong. And that's what Kohlberg is all about. Now, when we get to the older school age children, what is Kohlberg talking about? It's not reward and punishment anymore. It's knowing if I do right, I'm going to please my elders and everybody. So I'm going to conform to the rules to please other people. And that's Kohlberg. I know what I need to do and I'm going to do it. Spiritual development. So again, very concrete terms. They've had to see it, whether it's they've seen, different religious, things, a Christmas tree, a menorah, or whatever. They see it and they ask questions about it. They really want to know, and they really have a desire to understand whatever the God of that family is. Remember, we're all different, all culturally different. We all believe, we all have our own faith in the way we practice it. And the child at this point knows the family. They're just starting to understand other people's perspective through their best friend, their peer, same sex peer. Now, with spirituality, the big thing, the big concept here is children expect to be punished when they do something bad, whether they fall down, break their arm because they hit the sister yesterday. That is what they believe. Their appendix bust because, they didn't help mommy take the groceries in yesterday or whatever little silly thing. But this is what school age children believe. Okay. So again, with spiritual, know that children think they're being punished. And the one thing that I've always done, and I've understood this, is especially children go into the OR, like with an appendix, I'll sit down with them and say, listen, you didn't do anything wrong for your appendix to say it doesn't want to be there. They don't need it. And sometimes they just say, hey, I'm done. Take me out. And that's what happened with you. So don't worry. God's not punishing you. It's just the organ didn't want to be there. And you would be surprised how these children go, oh, okay. And you can see them relax because they do. This is exactly what they believe. Social development, being in peer groups, Girl Scouts, Boy Scouts, sports groups, whatever, whatever. Again, we're getting away from parents. We have other adults that are starting to influence our children in these groups. Again, also same sex peers usually are in the same group, whatever you are. If you like soccer, your same sex peer is probably going to be with you, or you're going to be with them in whatever they want to do. It's just part of what children do for their same sex peers. Clubs, peer groups, they're great. They make them do something, like Girl Scouts getting their badges, some rewards for it. But remember, you'll have girls that get extra badges who think they're more special or whatever. And now the bullying starts. And remember, as parents, we need to teach them that they need to be parents. They don't need to be friends now. And after they're coming home from these events, whether it's clubs, whether it's sports, they need to be talking to their children. So how was your time? What happened? What did the teacher do? What this, what? You know, um, Making sure that you're keeping children safe. That's what we teach at this point. Children from the day they wake up, from the day they're born, what do they want to do is to play, right? Well, of course, it continues through school age children. It gets in school age. Now they're more into rules and rituals. It could be now they know that they play checkers. These are the real rules. Or if they play this, it's that rules. That's the same thing we do over and over again. It's not make it up the way we want to play it. like younger kids do, playing together, team, soccer, softball, whatever it is. Again, it is things ego mastery, and that could be like playing an instrument. That could be cooking, that could be writing, that could be whatever they like to do, whatever they like to do for fun. They're starting to develop a self-concept. They're aware of themselves, their appearance, their hair, their eyes. Again, um, many other people are influencing your child at this point because they are involved in school and activities and friends, et cetera, et cetera. Their body image, they usually notice their hair and their eyes. They like their blonde hair, their curly hair, their blue eyes, or their long eyelashes, right? Body image is um part of way that they are expressed by their adults in the house. So if they're always said, "Oh, you look so good, you're cute, you're handsome, you're smart," well, of course, that's always going to influence the way that they think about themselves. Knowing that there are children with glasses, braces, hearing aids, and all of that, just be aware of it. And I think today is they're aware, but yeah, okay, whatever. Let's keep going. It's just that they just have a hearing aid. It's not as much as tinsel teeth, like we used to call the braces when I was a kid. Um, but again, it's that body image is very important. Feeling part of the group. We know that as preschoolers, they're in preschool, we're getting them ready and reading, and we're promoting school. And then we know they get into school. And as they get into school age, it's not just now doing the tasks and the assignments. It's also that camaraderie, that peer relationships that are forming and learning other families, other people's, other peers, the other way that other people do things. Because the way that I make tea, you could make tea different. I mean, it's just they're all different and that simplicity, okay? And again, always remember peer relationships are important. Now, nutrition, nutrition, nutrition. Well, we've talked about nutrition weighing too much, too little. School-age children, yes, we do have some overweight children, underweight children, and we are going to teach nutrition. And tell you the reason why. It's for life. School age children. When I was doing my dissertation for my PhD, my subject group was school age children. And during that research, I found out school age children are a really good, reputable group to study. They do give great answers. So, why would we teach nutrition to school age children? Because they become adults with problems. Let's say they are obese, school-age child. They're going to end up obese adolescents. And they're going to have these cardiometabolic changes, whether it's high cholesterol, diabetes, high blood pressure, because it wasn't treated as a school age. Now, school age children you teach, they learn, and they like to do what they are taught. So it's a great, great age to teach to prevent these problems from going forward and having adolescents with diabetes that become adults with diabetes. So teaching them is very, very important. Now, school age children, of course, now have their own preferences of all their foods, like the picky toddlers. They're eating more, but of course, they'll always have their own choices. We all have our own choices. On the internet, there's something called My Plate. And My Plate is a program that they teach these school age children to look at their diet, what they take daily, weekly. Are they getting enough of the proper food groups? And this will show that child what they need to eat more of if they have that ability at home, because not always those good fresh fruits, vegetables are available. And sometimes they're just too darn expensive to buy. So, but again, My Plate is great. Today we eat a lot of fast food. We're busy. We're busy people. Mothers and fathers are working, going to school, raising families, and you don't have time to cook dinner. So you go through a fast food. Now, occasionally that's okay, but remember with fast food, it's high fat, high calorie, and it ends up with children and adults who gain weight. Now, regarding that, school-age children and being obese. We know today it is reaching epidemic proportions. Why? Well, that's good old technology. It's those, phones, computers, video games, they're playing all sorts of things 12 hours a day if you let them. Sometimes children can't go out in their neighborhood. It's not a good neighborhood. Or, sometimes it's there's nobody supervising them. You don't want your kid there. As I said, overweight children are going to have problems in the future. And we know early education can help obesity. We can stop it now as a school age child and have that child grow up to be an adult, good, healthy adult. Preventative strategies should start in intrautero. Mommy's pregnant, you should eat right. Preventing obesity, like eating proper foods. Um, it hits every single ethnic group. Like when we say sickle cell disease, we know that's, African American. Obesity, everybody. There's no ethnic group involved in it, okay? It all levels of society, it just happens to all of us, okay? One of the things that was written was about school age children being made to sit there and finish their food when they're not hungry. Now, yes, if they've had a snack and they shouldn't have, or they filled up with juice before they ate, and they're not going to eat all their food. Now, the thing with this is, and what they're thinking is that if you're a child who had to finish all their food, you're going to be an adult who always feels like they have to finish their food, and that can lead to obesity. That's what that's talking about. Sleep. Well, remember, adolescents, that beginning, they're growing really quick, right? That 25% of their body weight is in that pre-adolescent growth. And that's usually right at the beginning of puberty, okay? Now, they do need 9 to 11 hours. But what happens with these children? Well, the younger kids are going to fight it. They're, want another glass of milk, another kiss by, daddy, and this and it is and it is. Okay. No, those things happen. But when they get older, it's time to go to bed, they go to bed, and they're tired and, they're going to read their book and go to bed, whatever it has to do. Again, we've already talked about sports and that participation. And yes, children love competition, but again, it should be with parents' involvement and helping them with that competition because it's not always fair, right? Again, all of those type of media things, it should be limited. We're lucky today. They've got these little time devices I found out that you could put your phone, you'll be on the computer this much, and they lock them out. My son-in-law did that. I was like, oh, I didn't know they could do. It's a good thing to have. Dental health. They say that baby teeth start falling out at 6 months and your permanent teeth start coming in. Remember, teeth coming out, they're falling out. Don't all the baby teeth fall out at this point in time? What they're promoting at this time is to brush their teeth morning and before they go to bed, and they should floss. Problem is with flossing, the younger school age children don't have that manual dexterity to floss. So they say after that, or the mother should do it, the parents, whoever, help them floss their teeth out. That helps keep their teeth. Or it's permanent, it's forever. You're going to have them for the next 90 years if they're alive that long. So to take care of them. We know that teeth could be, needing braces. We know periodontal diseases. And then what about that tooth? And it's usually one of the front upper teeth where they fall down on a monkey bar, they fall and they slip and their face hits the side of a swimming pool, and that whole tooth, that front tooth pops out, root and all, and there it is on the ground. What are you going to do? Well, I know I would have a moment because I know dentists are expensive. We know that insurance doesn't cover much of them, right? So what can I do? What can I teach parents to do in case? Well, that tooth with the root can be reinserted. And I'd highly suggest that if it was a permanent tooth, because if we don't get that tooth back in, then you have to put in a plug and a cap and all of this extra stuff going on, and being expensive and time consuming are the two things with that. So what do you do when that tooth falls out? You take the tooth and you put it in cold milk. I think the cold prevents bacteria from growing. I think. I'm not sure. This is my premise here. And I think the milk with the calcium protects it, the enamel. You bring it to a pediatric dentist or pediatric ER, and I've helped with many of these. They numb the area where the tooth's going in with this ointment, this cream stuff, and it numbs it. And then the dentist takes and pushes it in there and holds it for a second. And then the child is told not to eat only soft, things for the next couple days, and then see the doctor in what, 3, 4 days, whatever it is. Many of them take. So it doesn't end up with a big dentist bill because the whole tooth came out. Never handle the root, only the stuff that hangs out in your mouth. Sex education, they're starting to understand and want to know more about it. Remember, schoolers are starting to masturbate, talking about mommies and daddies and differences, right? Well, it continues. It's just part of it. Sex play is part of it. The big thing is, again, having an open communication with parents. Now, I know that not every parent talks about this stuff. My parents never talked about it. None. I had 6 brothers and me, and my mother asked me on my wedding day if I had thought about birth control. So that was never talked. So would have been my choice back then. School nurse. School nurse is like the biggest resource, probably the most underused resource that we have out there. So anything a parent can't do, sexual education, medical, anything, nurse. So treating sex as normal, asking questions, finding out what they know, and then responding to them. And of course, keeping communication with parents if we can, with a school nurse. And remember, if this child is telling you things, the adolescent, let's say older school age, and they're talking sex and sex ed, those things, remember, we only give oral and written information. We don't give our opinions. I don't think a 12-year-old should be having sex, but we need to give oral and written information regarding it. It's not, the book says we don't say our opinion. The school health is a newer area where we're using a lot more, especially since COVID. It is a great job. They have all holidays of children off, weekends off, right? Nights off, holidays off. And they're doing a lot in there. They have children coming to their office. They have children that need medications that go to the office, or let's say there was a meningitis breakout. They're following that up. That COVID, they were a part of notifying CDC and figuring out school systems what they need to do to keep their children and the staff safe, right? So school nurses do quite a bit in their, if you like to work around kids, a lot of kids. School age and injury prevention. Remember, injury prevention, any age child is motor vehicle. Motor vehicle, always. Remember, when a child is in a stressful situation, a stressful family, they're acting out, right? This is also that child which is at a higher risk for injuries because they're stressed, they're not thinking right, and they tend to take chances, and they tend to get other injuries because they're angry. That stress, this is what way it comes out in. So according to your quiz, car seats get turned around front facing and rear seat at age 2, or 30 pounds. Christian was 25 pounds at age 2. We asked the pediatrician. It was the age that got him turned around because it was muscle control. It wasn't the weight. So it's either or weight or the age of 2. They should be in the rear seat, even teenagers up to age 13 to protect them. They should be in a booster seat until age 8. Now, I live in South Florida, and there's a lot of open space Everglades, and there's always ATVs, motorcycles, whatnot going out there. One of the things the book promotes is that ATVs are not recommended for children under 16 years of age. They feel that they're too dangerous and they could get hurt. Um, I've also heard of parents say, well, just I'll sit there and watch. Well, they get on that ATV and they're gone, and then you don't see them. So you really aren't watching them. So, again, important concept. Children under 16, no ATVs. Always remember proper equipment, safety equipment. Trampolines, look at this, highest injury for ages 5 to 14. I hate to see them when I look out my backyard and I see a trampoline in a neighbor's yard. I'm waiting for a kid to start screaming because I know that they do cause injuries. I would never allow one in my house, but I'll take them to a trampoline park, let them go bounce on trampolines all day long, but not my backyard. So, school age children. Now we are there and they are getting more independent. Parents need to be there, but you don't need to be as obtrusive and up into their business, but you need to be seeing what's happening, like sort of looking and not letting the child make mistakes like the toddler. Give them a chance to make some mistakes as long as they're not hurting themselves or others. Remember, they're going from only the family as their number one. Now they're broadening off and they're having other friends, other families, other mothers and fathers that they're getting along with. ADHD is something that usually happens where the teacher in a classroom has a child that can't sit and finish a task. And it becomes to the point where they become disruptive. So they send them to the school nurse. And it happens more than once. The school nurse then makes an appointment to have the parents come in and let's talk about what do we need to do. This child appears to have, right? So, one of the things about ADHD, and I know because I had a best friend whose son was ADHD. They tried to label him as a spoiled child who didn't want to listen. The child went from task to task to task to task. ADHD. He ended up on medications eventually, but ADHD can be misperceived. So, as a school nurse, how do you interview these parents? Well, number one, sit back and say, so tell me what's going on with Charlie? What's going on with Beth? And they can tell you, well, we've tried this, we've done this, we took away this, we've got them on this, we did this. And after they tell you everything they're trying to do, then work up a plan. Don't assume the parents are doing nothing because the child's acting out. We haven't gotten to that point where we can control them yet. It's not their fault. ADHD is a medical problem, okay? Just like depression, just like diabetes, they're a medical problem. So again, school nurses are involved with that. Enuresis can be urinating in the bedtime, at bedtime at night. Um, it could happen like all of a sudden sporadically, just once. And that's just okay, it happened. There are other times where they're consistently going to bed and wetting every night. Now, aren't there diagnoses that could have an increased urinary output, which might be telling something? Diabetes mellitus, increased thirst, increased urination, right? Diabetes insipidus, increased thirst, increased urination, urinary tract infection, urgency. So there's all different things it could be. So we take the child to the doctor, we'll do a workup, If they need medications or alternative, whatever, work with them to try to stop that child, find out the reason while they're urinating at night, um, and then do whatever the plan is to fix it. Now, acoparesis, this is when a child is doesn't go and move their bowels completely, or they hold it. One of the things, and we'll learn this in the GI book, area, but children, the one thing they control is their bowel movements. There are young children, 7 and 10 days, that won't stool. So this is an older child. This is school age children that aren't moving it completely for whatever reason. It could be structural, or it could be dietary, it could be stress, behavioral things going on. So with acoparesis, number one, determining what they find is the mother's finding like stooling, mucusy in the underwear. And that's the telltale sign. Something's going on. And then it's then going and doing, the workup, because a little of the mucus comes around the stool and it escapes. Sometimes you have diarrhea with constipation, right? All that extra stuff comes around and that comes out. So that's acoparesis. So the child has that knocked out tooth. The parents are reluctant to reimplant the tooth. Where should the tooth be placed for transport?
A.
In cold milk. Yes, it doesn't matter, a baggie, a jar, whatever. Put it and cover it with milk. Cold milk. Okay, adolescence, the bane of my existence as a single parent. The hardest thing I've ever done was raise 2 adolescents alone. I met my husband today when my daughter was 18. So I was alone since she was 9. And it was a very difficult thing. And I describe adolescence as a roller coaster ride. And as a parent, I tell parents, hold on to that roller coaster, hang on for those ups and downs of adolescence, and don't give up, don't let go. And it's the one things my parents tell me, my children tell me, the one thing I never let go. I was always there. I was a bane in their existence, and they thank me for everything I did today. So we know adolescence, it's hard. You're going from that middle school pudgy, non-figured, not, menstrual yet. You're just in that in-between stage. And then by you get out of high school, it's that rapid physical, cognitive, social, emotional change that goes on. And 20 to 25% of your height and weight right there in that first 2 years, like that 12 to 14 area is where it's going on. Okay. We know that adolescence starts with the beginning of those sex characteristics. So, girls, what's the first sex characteristics? It's nipple buds. Boys, an enlarged scrotum. Those are 2 things I've seen questions on. So there it is. Boys, testicular enlargement. Girls, it's the breast buds. And know that the one medical treatment that we do at this age, we had Hep B for infants at birth, right? Well, when we get to be adolescents, we're going to be doing the HPV 3-dose series. And that's to prevent cervical cancer. And boys and girls. Now, this is Tanner's stage of development according to menstrual cycles, and puberty. Now, why did I put this here? There's been questions I've seen referred to. I've heard students tell me on NCLEX, and I think I've seen it on the HESI. Remember, I don't see HESI. I don't know the questions, but I see concepts. Now, Tanner stage 1 is the child that's the young child. That means all baby characteristics. Number 2 is that beginning. So girls, breast buds, boys, an enlarged scrotum, testicles. Number 5, so that's 3, 4, and 5 is complete adult. So if you were to guess, which stage of development would have, you could sort of figure it out by knowing that age 2 is the start and 5 is the finish. And that's why I put this Tanner stages of development here, okay? So as I said, 20 to 25% of the total height is achieved during puberty. And as I said, it's 2 to 3 years, those beginning of adolescence, okay? Obesity with early onset menarche in children, yes, it can. It doesn't affect boys. And one of the things that we see with the physical is voice changes is in both girls and boys. You know, you hear those little tiny little voices. I know I have a girlfriend up in New York, and every year for the birthday, I would call her son to tell him happy birthday. And I remember I was speaking to him a couple years back, and all of a sudden his voice went down 3 octaves. And I went, "Oh my God, when did you grow up?" You could tell that he was going through puberty. His voice had dropped, and it was a sudden, "Ooh, you're growing up on me, Mikey. When did that happen?" So here we are, Erickson. Erickson in adolescence. What does Erickson talk about? Psychosocial, how you deal with the environment around you. Well, your environment first starts with your body image. Who am I? What am I going to do with my life? Am I going to college? I'm staying home. Do I like boys? Do I like girls? Do I want to be in the drama group, the band group, the art group, the who group? I mean, you have to figure out all this stuff up. It is identity. Who am I? And then it's versus role diffusion. Where do you fit into all of this? Okay. And again, figuring out my body, too skinny, too fat, too many pimples, too many freckles, all of that stuff is part of everything they're concerned about. Now, we talked about, again, things and stress and whatnot with younger children, and school age children could be that acting out sort of things. Teenagers, because they're older and it's body image, and they can go into these depressions. Remember, any warning signs of suicide should be taken seriously. Now, this could be the child, your child themselves, or it could be your child's friend. If you say that they're going to commit suicide, take it seriously because there's a high incidence of suicide in adolescence. Some of the symptoms you might see is sleep disturbance, too much, too little, irritable, just not, you can't talk to them anymore. They're snapping at you. Changes in appetite, too much, too little, staying in a room, not coming out, and then and about death and dying. And these are things you might see. So socially, no, mom and dad aren't number one anymore. It is your buddies in them, as I call it with my children. You're going to go out with your buddies in them, right? So it's that independence. That's stepping away. That's learning other people. It's like this intense sociability. But children like to be out and be social and with people and feel involved and feel important. But what happens when your world shatters? As in, your best friend, you found him kissing your boyfriend. So now you've lost the best friend and your boyfriend. Stuff like this happens as adolescents, right? Now, intense loneliness. This is, what did I do wrong? I'm too ugly. I'm too fat. I'm too skinny. My clothes aren't good enough. My this, my that. All of these things. Again, these are those children that you need to be worried and concerned. Are they going to do something like suicide or hurt themselves? Okay. Relationships with parents are hard. Parents are now into protection. Okay. I mean, before that, it was just, parents were there and watching and protecting and etc. Now, this child is now wanting to break away. They want to do what they want when they want. And they don't want any responsibility with it. So, teenagers struggle with privileges, going out to the movies, going to the mall with their friends and them, and responsibility. What is a teenager's responsibility? And it's the parents' responsibility to let them know what they have to be doing. School, number one, right? Two, whatever chores in the house. And of course, respect, polite and respect. Those are things of those responsibilities. But what happens is adolescents, Okay, you have to be in at midnight. They don't come in till 2. They're having too much fun, or they sneak out the window, or all of these things. And they've all happened to me and the children's growing up. Okay. It is what we call major conflicts over independence and control over their responsibilities and their relationship with their parents. And this is at that 15 to 17. They're over that growth spurt. Boys look like men now, girls look like women now. So they are grown up and they feel grown up and they want grown up responsibilities, but they don't want any responsibility with it. They want to do what they want. So, what as a nurse would you suggest? Well, it is always sitting down with the child and, explaining what your goals are for them, let them know what their goals are, and try to work out a compromise. That to set the limits and the structure. It's the best thing, doesn't always happen. Relationships with peers, as I said, are very important. It makes them feel good. Know that best friends, the way that you treat them, and it's usually same-sex peers still as adolescents. Not all. I mean, mine was a male, but mostly they are females. And know that the way you treat them as an adolescent is probably the way that you are going to treat your partner for life. So, looking at your teenage son or daughter, the way that they're treating their partners is probably what you're going to see later on with them. Now, how do you talk to adolescents? Well, we've talked to adolescents. We know that it is getting on their level, right? Well, how do we do that with an adolescent? Well, I might see a Yankees hat on and I'll mention it. Or they might have a school shirt on, something, talk about it. Or maybe they have cute sneakers on, or make conversation and make it less threatening. If we see something's getting uncomfortable, remove the parents, talk to the parent, to the child, and give them an opportunity to express themselves. One thing that adolescents likes to do when you're talking with them, they like to say things to shock you. Be prepared for it. It will happen. And just keep going. Another thing, if we're finding out in this conversation that mom and dad don't want to talk to them regarding things, again, always recommend that school nurse. As I said, that 3-shot HPV. And then another thing about nutrition with these children. Remember, adolescents, they tend to grab a power bar and a water and they run out and they're on for the day and they don't stop and eat and they save the money for the weekend, right? So they're not eating the way that they should. So again, they're nutrition, especially during these growth periods. Now, sometimes adolescents way too much or too little. How could we figure out what needs to be done? Well, number one, you got to figure out what are they eating on a daily basis, right? So anything with children with their weight, too much, too little, and nutrition, number one, get a food diary from a day, for a week, for whatever. Food diary will tell you how you can make changes to help that child, that adolescent, get more of the foods that they need to do. So always remember that. Problems with weight, think food diary. Sleep, they should be getting sleep. We know that, but what are adolescents doing? Well, they're on their phones talking to their new best friend, their new boyfriend. They're studying for a test. They're out at a basketball game. They're all full of social activities and homework, and they're not getting the rest that they need. And it's just normal. They do need it with all that growth spurt, but they're really not getting as much as they should. They need to be up and moving, and of course, they need to pay attention to their teeth because they're permanent. Sexuality again, I've mentioned it as a nurse. We can talk to them, written and oral information, okay? And we can send them back to their parents if they'll talk to them, school nurse, and Planned Parenthood if it still stays around. Remember safety, any age child, the biggest thing, motor vehicle injuries, right? Well, adolescents are driving. So now we've got adolescents out there doing crazy things, things that I've seen, through the years. children getting on top of the hood of cars and the guy driving it and trying to make circles and swing them off and put them onto the asphalt, and those are injuries, okay? And then of course they do things like run over them and they don't want to. Firearms, they're starting to think I'm old enough to touch the handgun now. Let me go pick it up and let me touch it. And but they don't know anything about it. It goes off, and of course, injury. Sports injury will always be a thing, and injury prevention, using proper protection, equipment, etc. So Matt is 14 years old. What age is that? Right at that 12 to 14. That's where they're growing, pre-adolescent growth spurt. Seems to be always eating, although his weight is appropriate for his height. Best explanation for this is what? He's eating. His weight's appropriate. Why? It's normal. Because remember, he's gaining 20 to 25% of his height. So there's more body mass. So he's eating the fuel to grow, just like the infant eating, eating, eating to grow. Hey, let's do our cahoots and we'll be out of here. Just about what I told you. Questions? Anybody? Kaylee, are you with me? Or are you just off a camera for a moment?
No, I'm here. My daughter just got home, so I'm letting her in the house.
Okay, okay. Thank you so much.
Okay.
Just making sure. Who wants to win a cahoots today? Ariana, are you going to try?
I guess.
Eh. Danielle, you look like you want to win today. Either the Danielles. You're right next to me on my screen, both of you. All right, let's go for it. I think there's 32, 30 something. There are not too many today. So we should be right out about 10 after at the latest. Winner, winner. Now that's a positive attitude. So Ariana, the message, yes, perfect. I love that. Very good one. I've actually seen two of those in my career. Big Mama, that's me. Oh, and there it's me. All right, that's enough. That was funny. Week 3, school age and adolescent children. How does the onset of the pubertal growth spurt compare in girls and boys? I always said, I remember being in 5th grade, so I would be 10 years old. And I remember thinking boys were just silly and dumb and immature and stupid. And then all of a sudden by 12, the boys didn't seem as bad. And it really fits into this. It's 2 years before boys. So at age 10 is usually when puberty starts. Again, that's their breast buds. And in boys, of course, it's going to be scrotal enlargement. Say, what activities are appropriate for a 6-year-old child? So this is looking at gross motor skills. This is looking at what should a child be able to do mentally and physically. So we can do all of the gross motor, right? A bike, hop, scotch, jump, and rope. Competitive sports are a little bit too early. Now, Many children are in T-ball and things like that. But according to the book, it's not recommended yet for ages 6. They feel mentally they're too young, and with all of the bullying and the stress with it, they need to wait just a little longer. That's what that's about.
Did it say select all that apply or?
At what age should a parent expect to have major conflicts over independence control with their child? I'll have to go back and look at that question, whoever asked that. So that question was select all, was all the gross motor skills they could do, but playing competitive sports, it's a little too early for them. That was that question. I hope I answered you. Major conflicts over independence and control. That is those adolescents right after they've grown up and now they look like men and women, 15 to 17. Signs of onset of puberty in girls. So, girls, it's the breast buds. All of a sudden you see them, we know it's happening. The onset of puberty in boys is characterized by, as a mother, it's easy to see girls, but it was hard to see my son. I didn't know when he was going through it, right? And that is the enlarged testicles, scrotum. What do we use to determine if a female has reached the age of menarche? So, looking at all the symptoms of what's going on, she has breasts. Does she have hair? Does she have pubic hair? All of these things. What do you fit that into to figure out? And that's the Tanner staging. It tells you where you are. Are you in full menarche or are you still going to the point where you're full adult female or male? An child goes to the ER with a low fever, pruritic rashes, and open oozing papules. Nursing care includes. Now, this situation has happened to me a couple times. The other thing I might say is different levels of healing would really put that more in light to me. Any child who comes in with papules and rashing and fever, you're going to say, is this varicella? Is this chickenpox? Now, varicella is airborne. So if you suspect, whether you're right or wrong, it doesn't matter. Be safe than sorry. Put an N95 mask on you first, and then put one on that child and get them into a negative pressure room. All ERs, all hospitals, urgent cares, they all have them. And that keeps the air going outside, not back into the area so other children will get it. So this is one of those questions, figuring out what does those symptoms come up to, okay? It's that oozing papules, itchy rashes, and then, of course, it's that low fever. The source of injury, whether intentional or unintentional in adolescence, is associated with what? Injuries. What's the number one injuries in children? And of course, it's motor vehicles. A 9-year-old friends tell him soccer's a dumb game and he should play baseball. It's his friend. It's his same-sex peer. He don't want to play soccer. He wants baseball. What's going to happen? Remember, 9-year-olds, school age, same-sex peers are the most important people that they have. So here, acceptance is so important. So many children, they want to play baseball, but they'll play soccer, or soccer, play baseball, because they want to be with their peer same-sex friend. During admission, the father of a 16-year-old says, we're Buddhist. Culturally competent care includes what? So whenever whenever you are with a culture or something that you don't understand, what I have learned from the very beginning, I will say, I don't understand, or can you tell me, are there any special needs that I need to do for your child? And I will tell you that a parent will be so happy that you asked that question. I'm sure there's been other experiences where the nurse didn't, and maybe they're vegetarian and a piece of steak came up or a sausage on their plate. Those things would upset them. So asking is your first thing. Whether you ask an adolescent child or ask the parents, because an adolescent knows the differences and their preferences, okay? When teaching sex education and contraceptive for adolescents, what should the nurse consider? Well, sex education, if it doesn't come from mom, at least there's school nurse or maybe a Planned Parenthood. And when you're discussing that sex education, it's written and oral information. It's not what you think or what you want to say. I could say they should be, abstinent, but that's not my decision for them. It's just giving them education, proper information. Sorry. The management of adolescent obesity should include what? Whenever you talk about weight, too much, too little, what's number one you need to look at? And that's that 24-hour diet. Also, in any diet, there needs to be something to look forward to. For me, I want a bowl of ice cream or I want a grilled cheese sandwich. I mean, either or. I'll take one of those. I'll be happy. Once a day, once a week, on this day, you can have one thing. Putting nutritious food in a method of reward. Okay, here's a lot of carrots. You can eat those. Those are your reward. I'm sorry, that's not a reward for somebody. And then diversion is younger children, okay? Which action would improve dental health in the school age child? Well, all age. Anybody with permanent teeth, what are you going to do? So, child should floss. If they can't, parents can do it for them. An 8-year-old girl says that she has cancer because God is punishing her for being bad. Why is that girl saying that? Is that normal? So remember, children, I hit my sister yesterday, and that's why I broke my arm today. And it's one of those things that I will say, you have a broken arm. It had nothing to do with your sister being, hitting your sister or whatever. It is a common belief, and it's just part of them trying to do the right thing. It's the way that they know how to deal with getting something bad happen to them. A 6-year-old needs a chest x-ray. What explanation is the best? I have these gamma radiation rays and I'm going to turn them on and they're going to go right through your chest and I can see inside. No, I don't think that would work. So all we need to do is tell them it's taking a picture. I'm going to look inside. And then the second part of that, you're going to show them the x-ray, show them the broken bone, show them where that consolidation pneumonia is. Very easy to see. How can you get an adolescent to be more receptive to talking about their health and sexual exploration? You know, a lot of times I find out with this, it's girls that are coming in with frequent urinary tract infections. And I'll have parents step out and I'll talk to them and they'll tell me they're sexually active, but they didn't tell their parents. So again, have the parents walk out and then have the discussion with the child. And again, anything that's going to harm themselves or others, of course, we'll tell someone. But if not, let the child know, keep it in confidence, and then do what you can do to help them because adolescents are going to do what they want. So
I
give
do have a
them,
question on that.
hold on
What
a
is
sec.
the age that you like don't have to talk to the parents? Is it 16?
Yes.
Okay, okay. I just wanted to make sure and double check.
So knocked out tooth, where are you going to put it? You know, as we go on into testings, there's not an age group we put there. We just generalize it, okay? Just to let you know. So you don't have to think of a date, an age of when do you tell them or bring them out, etc. So again, yes, it's cold milk. Hopefully it can re-implant. A nurse planning for care of a school-age child should know which thought process is seen. So school-age children, how do they think? I mean, animism is your preschooler, where you take a tree and you put arms over it so that it keeps the leaves help keep the tree dry when it rains, right? Making it into an animal. Magical thinking again is preschoolers, you know, taking toys and making them work. Remember, school age is about that conserve. I'm telling you, it's a weird word. You're going to see this again. Conserve is like the glass of milk, one short, one tall. They know that they're the same amount. Clay, big clay, small clay, it's still the same amount. Ability to conserve, their thought process. What stage of Erickson would you use for a school age child? What's a psychosocial? How they deal with the world. And it's industry versus inferiority. My industry, my product, what I do well, but I can't do everything well. So versus inferiority. Trust versus mistrust, an infant. When I cry, somebody gets me, I'm trusting. Initiative versus guilt, that is your preschoolers doing things for parents trying to help but not doing it all correct, so you feel guilty. And don't forget autonomy versus shame and doubt. Toddler, automatically me, mine, I do, and then somebody telling them no, don't do that, you'll hurt yourself. Shame and doubt. Okay, those are the four Ericksons. You're going to see them in all different ways and you're going to see them on the exam. School age children's moral development. Who talks about morality? We know moral development preschoolers is more about reward and punishment. We know that toddlers and infants, they don't really have any moral development yet. Maybe a little bit at the end of toddlers, but preschoolers, they understand reward and punishment. School age want to please. They conform to rules, they want to please. It's not the others. Multi. Anorexia nervosa is characterized by. Now, I can't put everything in a PowerPoint. I just wanted to go over some eating disorders, nutrition, right? So we're going to come up with two of them, anorexia nervosa and bulimia. Anorexia nervosa and bulimia are both about severe weight loss and worrying about body image, et cetera, et cetera. Anorexia nervosa is not putting anything in the mouth, water and a piece of lettuce, and exercising like crazy. They are 70 pounds and still feel fat. It's that unrealistic body image. It's a fear of weight gain. And again, it's severe calorie restriction. The difference between some of these things is anorexia, you don't eat. Bulimia, you just eat a lot and vomit it up. So those are the two different ones. So what behaviors would you see with a child with bulimia? And you're going to say children get bulimia? Well, look about that body image and those early adolescents or late school age children. They feel bad or somebody called them fat. And now, guess what? They're going to do something to help themselves. Or so they think. So bulimia, they eat like crazy. And then they vomit, vomit, vomit. Sometimes they do it. I've seen documentaries where they have big gallon baggies that they puke in and then they take and line them up. Or they're into the bathroom all the time. And the difference between anorexia nervosa and bulimia, and how would you know it, is teeth. Bulimics are vomiting. They're vomiting stomach acid, their teeth rot. Anorexia nervosa, they're not eating, so their teeth don't rot. That's the difference. What is an adolescent's heart rate? Now, I put this in here just to tell you that some questions, medications, fever, dehydration, your pain, you need to know what heart rates normals are. So I'm going to throw one in here every now and then. And this one's about 55 to 90. Now, why isn't it 120? 120 is too high. That's pain, that's fever, that's dehydration. They're a little bit more effective heart beating. That's why it's a little bit slower. It's not 60 to 100 like the adult, okay? When taking an adolescent regarding personal healthcare concern, which is most important? So you're talking to an adolescent. What do you need to remember? So always give them the opportunity to express themselves open and honestly. And as I told you, be prepared. They're going to tell you something. They're going to try to shock you. A parent says their infant puts everything in their mouth. Based on Freud's theory, you would respond. You know, you'll always see before an exam a couple different concepts that you're going to see on an exam. And I'm going to throw them on the Kahoots. You know, just as that re-emphasis, looking at Freud. What is Freud? What is infants? That is oral, everything in the mouth. Why do they put everything in the mouth? They explore the world in their mouth and they self-soothing with the mouth. Multi. What could be a sign of potential child abuse? They said probably the hardest part of me working in the emergency room for the last 10 years was, you know, seeing a couple child abuse and seeing what happened. One of them, I'm the one who found it and reported it. And I know that child is safe today, and it was an infant. So somebody who couldn't tell me anything. When there is an inconsistency between injuries noted in the history, there's a problem. Like that couldn't have happened by falling here. Different stories, child and parent. Try to usually talk to the child when I get him into the X-ray room. You know, the parent's not in there. I'll try to figure out. And again, sometimes children are just afraid to talk. And yeah, you don't usually hear parents talk about how they're just so worried, okay? It's usually they're quiet sitting there and usually crying. They're upset. It's not they're don't always. In school age conflict of industry versus inferiority, what does industry mean? Remember industry, factory, product, what they do well, right? So that's mastering a task. What clinical findings does not indicate an adolescent may be suffering from anorexia nervosa. So they're not anorexia nervosa. What's showing you that? So remember, bulimics vomit, stomach acid rots the teeth. And that's the difference that you would see with a long-term patient who's been vomiting for quite a while with bulimia. Cooperative play. This is an important thing. There's 3 plays you need to know. Number 1, toddlers play next to each other, no sharing, parallel play. Preschoolers play with all the same toys, but there's no goal. Cooperative play is 2 or more children playing together, and guess what? There's a goal, there's a house, there's a train track, there's something that they work towards together, whether it's a board game or whether it's putting something together. So you need to know that. Parallel, associative, cooperative. Try to remember them. What does moral and development involve? Morals, morality. Kohlberg, right? What does he say? And there's a little toddler that's saying, gimme, 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 I want the ball. Typical toddler. So anything with morality, Kohlberg, right or wrong, and a consequence for each. Developmental milestones are important to observe because why do I need to know a child can sit unsupported at 8 months old? Why do I need to know that? Well, if it's 12 months and they can't sit, something neurologically is going on, right? I need to find out. So they're important because they give me clues. And then we go and we find out why they're not where they need to be. And then we give early intervention. Early intervention could be speech, physical, or occupational therapy. And you know what's the best thing about children? Once you institute some sort of therapy, children catch up quick. And even children that you don't think are going to amount to nothing can actually be quite do quite a bit of things. I've known an autistic Downs little boy that you think there'd be no way that you could control him. And I watched that child come into a daycare, sit down, get vital signs, go where he need to do. And you didn't have this child screaming and yelling. He knew what was coming next. And the reason why? Routine structure. Which of the following immunizations is given in the adolescent stage? Which one did I mention? So in the adolescents, what we do is the HPV. It's a 3 series, and again, it's boys or girls. You know, varicella is about 15 months, 2 years. Influenza, we don't start till 6 months old, and then we give it every year thereafter. ADHD most likely involves which of the following? So ADHD is that inattentive, distractive impulsivity, hyperactivity. It's the inability to finish a task. A multi. An adolescent's been brought to the emergency room with a drug overdose. What is the initial questions to ask? So this child's awake enough that you can ask questions. What are you going to ask? You know, the one thing about drugs is, you know, what did they take? When did they take? And the thing is the method. IV goes away quicker. PO actually lasts longer. So knowing what method, it will depend on what, if we give an antidote or not. Depends on where we are in the cycle of that drug overdose. So it is important. We're not talking about rehab yet. It's too early. A 9-year-old recently has stomach pains in school. Also, the child has been aggressive and stubborn. Why? Recently has stomach pains. That means they didn't before. Oh, and now they're aggressive and stubborn. Why? What's happening? And yes, the stress. Very good. That could be the way that it's seen. One last question. A multi. A nurse teaches a safety course to school-age children about their community. What should she include? You know, school age children ages 6 to 12, many of them do come home to an empty house and, they want to, make a macaroni and cheese or something, right? So they're going to use a microwave. Yes, that'd be something that they could teach. Water safety, so important. I'm telling you, I haven't seen drownings. Remember, I live in South Florida, so I've seen a few and I've seen some devastating things that have happened with it. So water safety important. I know Christian at age 2 could do front flips into the pool with no swimmies on. It's something I taught early, and he'll never go into the pool or near it unless he asks me first. So it's one of the things. And of course, appropriate car restraint. Now, fear of stranger, that's a global, yeah, I guess we could include that with it. Let's see how we did today. Number 3, Nix. Good job, Nix. Number 2, Donald. And number 1, Autumn. Good job, Autumn. And Sam and Monica. So that's the end of week 3. Remember, next week you're going to be here for the exam. Make sure that you come a little bit early so that we can set you up. You come in on 2 devices. Make sure they're both charged, ready to go. Now, if any of you want to be on campus, I need to know from you by Friday. Have that person send me an email, and you send me an email telling me that's where you're going to test. I don't mind doing that at all. I just have to make a separate exam and a separate access code. So I need to know by Friday to get that all done for you all. So remember, you have a CJ Sims, you have NCLEX questions. I wish you all good luck. Anybody who wants to do a once over before the exam, you let me know. I'll be more than willing to do that for you. Thursdays and Fridays, I'm pretty open. I am doing that review on Thursday at 4 p.m. if you could come, and I'll probably have that posted by about 6 o'clock on Thursday. Get it up pretty quick for you, okay? Keegan, she is adorable. She is your mini you, for sure. Good luck, guys. Thank
She
you so
looks
much.
very much like me.
Oh, yes. And Kaylee, that's your mini you too. Oh, my goodness.
Can you say bye?
Unbelievable. Bye-bye, Kaylee.
Say bye.
Bye-bye, Keegan. See you guys.
Have a good day.